Welcome. Thank you for joining us.
Thank you.
Ethics Alive is about achieving what?
It's about achieving a consciousness of ethical and professional practice in healthcare. It basically involves the entire faculty together with its undergraduate and postgraduate students and staff. And we have a week of activities whereby we actually examine our professionalism in healthcare. And
what is the state of professionalism? In that examination, in the past, what has emerged?
What has emerged is that, we've moved more and more away from respecting our patients. And we've also had huge challenges to professionalism in terms of when you look at the public sector, in terms of the working conditions, in terms of the lack of access to healthcare, and in terms of the corruption that we see in management and mismanagement of finances as well. And these are the things that we actually question, and we try to raise awareness of these issues, and in so doing, instill in our practitioners that professionalism extends to advocacy for our patients' best interests as well.
What has happened to respect for patients? Why has it deteriorated?
Well, when you look at the complaints against practitioners at the level of the Health Professions Council, there's been a massive increase in complaints. And when you actually tease out what they're mostly about, there's a lot in terms of fraudulent practice. And this is more in the private sector. And recently,
in the private sector?
Fraudulent practice in the private sector. And more recently, we've seen more and more allegations of sexual misconduct in the healthcare situation, complaints of this nature coming through.
So you spend this week discussing this, teasing out the issues, then what?
We have a theme every year, and this is running for the 5th year. Our theme this year is healthcare professionals and social conscience. And so we spend our week examining what our social conscience actually ought to be. And conscience, when you tease that down, is basically your inner right or wrong. And not only do we examine that, but how do we actually act on our social conscience?
So what comes out
our social
at
commitment? What comes out at the end, we have a huge symposium during the course of the week, the Thursday night, and then we get direction from the audience in terms of how we actually take things forward. And we work on this through the course of the year. Much of what we do tries to influence policy and also tries to influence our practitioners on the ground in terms of, their direct interaction with patients.
Now, looking back at the past 5 years, and you juxtapose some of the themes with the impact on the ground and the change in behavior potentially, what kind of outcomes are you seeing?
Well, in terms of the outcomes in our area, in the university's main hospitals, what we are seeing is a more dedicated practitioner. If you actually look at the state of health in the country at the moment, and you look at the state of healthcare delivery within the province of Gauteng, you find that because of our dedicated practitioners, we actually have healthcare running.
Okay. And things are getting better.
Yes.
Notwithstanding the difficulties that emerge.
Notwithstanding the problems that we have, I would think, yes, we do have problems in the public sector, but when you have this lack of respect for patients and complaints coming through to the Health Professions Council against practitioners, it's more in terms of practitioners from the private sector.
Okay. Thank you very much. Ames Dhai, Director of the Steve Biko Centre for Bioethics, joining us this morning talking about the work they'll be doing as part of Ethics Alive, an annual initiative spearheaded by the Centre for Bioethics.